हेलो दोस्तों, वेलकम टू मिस्टर वैभव भोसले प्रेजेंट नर्सिंग ज्ञान। और आज के इस वीडियो में हम देखने वाले हैं 20 इंपॉर्टेंट एमसीक्यूज रिलेटेड टू ह्यूमन रीनल सिस्टम, देयर आंसर एंड एक्सप्लेनेशन। सो लेट्स स्टार्ट विद द वीडियो। Question number 1. What is the primary function of kidneys? Options are produce insulin, filter waste from blood, pump the blood throughout the body, and store the bile. And the correct answer is option B, filter the waste from the blood. Kidneys remove the waste product and excess fluid from the blood to form urine. Question number 2. What is the functional unit of kidney? Options: nephron, alveolus, glomerulus, and loop of Henle. And the correct answer is option A, nephron. A nephron is structural and functional unit of kidney which are responsible for filtration and urine formation. Question number 3. What structure in the nephron is responsible for filtration? Options are loop of Henle, glomerulus, collecting duct, and proximal tubule. And the correct answer is option B, glomerulus. A glomerulus is a network of capillaries where blood filtration occurs. The next question: which hormone regulates the water reabsorption in kidneys? Options are insulin, antidiuretic hormone ADH, glucagon, and cortisol. And the correct answer is option B, antidiuretic hormone ADH. It increases the water reabsorption in the kidneys and reducing the urine output. So the option B is correct. Moving towards the next MCQ. Question number 5. Where does most of reabsorption occurs in the nephron? Options are collecting duct, proximal convoluted tubule, distal convoluted tubule, and glomerulus. And the correct answer is option B, proximal convoluted tubules. The proximal tubules reabsorb about 65% of filtered water and solutes. So the correct answer is option B. Question number 6. Which substance is not normally filtered by the kidneys? Options are water, glucose, protein, and sodium. And the correct answer is option C, proteins. Large proteins are normally too big to pass through the glomerular filtration barrier. So, proteins are not filtered by the kidneys. Next question. What part of nephron helps to concentrate the urine? Options are loop of Henle, Bowman's capsule, distal tubule, and collecting duct. And the correct answer is option A, loop of Henle. A loop of Henle create a concentration gradient that helps to concentrate the urine. So the correct answer is loop of Henle, option A. Moving towards the next MCQ. What is the role of aldosterone in kidney function? Options are increases sodium reabsorption, increases glucose metabolism, stimulate the RBC production, and inhibit the urine production. And the correct answer is option A, increases sodium reabsorption. Aldosterone increases the sodium reabsorption in the distal tubules, helping to regulate the blood pressure. Question number 9. Which kidney structure collects the urine before it moves to the ureter? Option: renal cortex, renal pelvis, glomerulus, and distal tubules. And the correct answer is option B, renal pelvis. Renal pelvis collects the urine before it is transported to the bladder via the ureter. So the correct answer is option B. Question number 10. Which of the following is not a waste product excreted in urine? Options are urea, creatinine, glucose, and uric acid. And the correct answer is option C, glucose. Glucose is normally reabsorbed in the proximal tubules and should not appear in urine. So the correct answer is option C, glucose. Next question. Which artery supplies the blood to the kidneys? Options are aorta, renal artery, hepatic artery, and pulmonary artery. And the correct answer is option B, renal artery. Renal arteries branch from the aorta and supplies the oxygenated blood to the kidneys. So the correct answer is option B. Next question. What condition result from inability of kidney to filter waste effectively? Options are hypertension, chronic kidney diseases CKD, diabetes mellitus and anemia. And the correct answer is option B, chronic kidney diseases CKD. It is a progressive loss of kidney function leading to the waste buildup in the blood. So in CKD there is no proper filtration of waste. Next question. What is the normal pH range of urine? Options 2 to 3, 4.5 to 8, 7.35 to 7.45 and 9 to 10. And the correct answer is option B, 4.5 to 8, because urine is slightly acidic to prevent the bacterial growth and maintain the homeostasis. So the correct answer is option B, urine is acidic. Which electrolyte is primarily regulated by kidneys? Options are calcium, sodium, iron and vitamin D. And the correct answer is option B, sodium. Kidney regulate the sodium balance which affect the blood pressure and fluid balance. So the correct answer is option B. Question number 15. What is the primary nitrogenous waste excreted in urine? Options are glucose, ammonia, urea and bilirubin. And the correct answer is option C, urea. Urea, it is a main nitrogen containing waste product formed from the protein metabolism. So the correct answer is option C, urea. Next question. What is the function of erythropoietin, a hormone produced by kidney? Options: stimulate the white blood cell production, increases the urine output, stimulate the RBC production and regulate the calcium level. And the correct answer is option C, stimulate the RBC's production. Erythropoietin stimulate the bone marrow to produce the red blood cells in response to low oxygen level. So the correct answer is option C. Question number 17. Which structure transport the urine from the kidneys to the bladder? Options are urethra, collecting duct, ureter and nephron. And the correct answer is option C, ureter. Ureter are muscular tubes that carry the urine from the kidney to the bladder. So the correct answer is option C. Question number 18. What condition occurs when kidney stone obstruct the urine flow? Options are hydronephrosis, glomerulonephritis, nephrotic syndrome and urinary tract infection. And the correct answer is option A, hydronephrosis. Hydronephrosis is a swelling of kidney due to the blocked urine flow. So the correct answer is hydronephrosis. Moving towards the next question. Which diagnostic test is commonly used to assess the kidney function? Options are liver function test, blood urea nitrogen and creatinine test, complete blood count and ECG. And the correct answer is option B, blood urea nitrogen and creatinine level. It is help to evaluate the kidney function and filtration efficiency. So the correct answer is option B. The last question. What is the condition called when the bladder is unable to empty fully? Options are urinary incontinence, urinary retention, renal failure and uremia. And the correct answer is option B, urinary retention. Urinary retention occurs when bladder does not empty completely, leading to discomfort and infection risk. So the correct answer is option B. We completed 20 important MCQs about renal system. Thank you so much for watching this video. Stay tuned for the more videos.